And welcome back. We continue our conversation with Michelle Graf and Jena Kloepfel from the organization known as Care Patrol. Your agency, Michelle, offers several services, one of them being memory care. Tell us about that.
Right. So memory care, unfortunately, is a little bit of a subjective term. A lot of people will say, you know, what is the best memory care, or what type of memory care do I need? The reality is every memory care that's out there has a little bit different specialty. Some are higher level, some are later stage dementia care, and there's a lot of memory care programs that can happen even before a placement into a facility. The Fox Valley Memory Project and the Alzheimer's Association offer memory cafes where somebody living with dementia and their caregiver loved one can come and participate in activities. That's a form of memory care. So it's really understanding what that individual person needs, where they're at in the progression of their disease, to find the right situation for them.
So, Jena, the memory care, how do you know if that's the right fit for your loved one? I guess maybe what I'm asking here is, how do you again broach that topic of mom or dad, we think you need memory care? Because they'll say, what do you mean?
Right.
Yeah. Well, if there's a memory impairment or there's been any kind of backslide in the cognitive state, memory care and having some of those supportive services are a really good start. But then as things progress, if there is dementia and not living in the home becomes an issue, then there's different communities that could support them in a higher level. You know, if there's wandering risks, then there's a different type of memory care that would be suitable. Or if it's just needing a higher level of supervision and redirection, then maybe a community that's not necessarily secure is going to be appropriate.
Mm-hmm. Of course, big issue for all families, most families, is the cost of these services. Mm-hmm. Is there a ballpark figure? Is there something that people can plan for?
It's hard to say because it's changing all the time. It does continue to go up. And some people have access to resources that can really help with that. Say, for example, veterans who have served in wartime. There's a really nice resource to help pay for that. There are federal programs and statewide grants that can help pay for care in a respite situation or long-term care through the Medicaid program. But for the most part, people pay for long-term care with the equity in their homes or their long-term care insurance. Mm-hmm. And typically the cost can be, if you're doing a very small amount of home care, just a few hours a day, it could be maybe $3,000 a month. And people in high level of memory care can be paying upwards of $7,000 or more per month.
Really, that much?
Yes.
Let me get to some of the different sorts of programs here. Independent living. What is independent living?
There's different types of independent living. So there's apartments that provide no services. It might
no
be
services?
Nope. Mm-hmm. It might be independent senior living where you just have an apartment and there's a lot of other seniors that live there. You have to be, say, 55 or 62 to live there. And, you know, I guess there might be a little bit of a service of some activities that are spontaneously planned, but typically it's the residents who plan those. There's other types of independent living where you can get a meal. There might be transportation services available and some scheduled activities by the facility, but those tend to cost more.
So independent living, this is something that you're not pushed into. This is something that you kind of decide to do.
It's a lifestyle choice. For people who move into senior independent living or even light levels of care, it's really a lifestyle choice, making them more independent in many ways. So they don't have to worry about all the cooking. They don't have to worry about the cleaning, or if they're no longer able to drive, they're able to have access to transportation right on site. It's really great.
So it's finally when somebody decides it's time for shuffleboard and cocktails.
Mm-hmm. Exactly. Living the good life.
Yeah, exactly. How can people prepare for the cost of independent living? I mean, is this something that you should have done long time ago?
Ideally, yeah, it is. Having a financial advisor and kind of looking at how you want your lifestyle to be early on and planning for that is a very smart thing to do, I would say, to make sure that you can live the lifestyle that you want. If you want to be more modest and live in your home as long as you possibly can, and you just want to have more of a nest egg for when that care is needed, you know, everyone has their own personal preference on what they want.
Give me the difference between independent living and assisted living.
So you transition from independent living to assisted living when you're receiving help with activities of daily living. So the things that you used to be able to do at home on your own, for example, maybe you always arranged your own medications and took those medications on your own, but perhaps you've developed a cognitive impairment and you need a little help. So then a nurse or a CNA would help you with that type of thing. That would be an example of an assisted living service. Also, a lot of times seniors need help with showers. Showers are a dangerous place for seniors, and so getting a little help with showers can be a form of assistance early on that people receive.
Do people generally know that they need to make the transition from independent to assisted, or do they need to be encouraged or
It depends
pushed?
on the person.
Yeah.
I mean, some people are very self-aware of their needs, whereas others need the encouragement from their loved ones or a professional that they have a relationship with.
What role does Medicaid play in all of this?
A very important role
Yeah.
for people who have no ability to pay for their own care, who need care. Medicaid's really the only access to that. People have a little bit of a misinterpretation that their medical insurance will pay for their care if they need it. It's true on a limited basis, so perhaps somebody goes to the hospital because they broke a leg or they're doing some sort of rehabilitation. Their medical insurance will pay for that type of rehabilitation and long-term care. But as soon as it becomes something that they're going to need on an ongoing basis, really those that help with activities of daily living, that's a privately funded situation. And if you don't have the funds, if you don't have the equity, if you have no ability to pay, then really Medicaid's the only solution.
Who needs to be in a nursing home?
Would you
At
like to answer
what
that?
level?
Yeah.
I mean, we've talked about independent living and then assisted living.
You need a pretty high level of care to actually need to be in a skilled nursing community.
Yeah.
Things such as a feeding tube or IV therapy, if it's a bariatric patient, so weight is an issue to where it's going to be unsafe for them to be in an assisted living. Those are things that would be a skilled need. Maybe they are a threat or they're harmful to themselves or others, then assisted living wouldn't be necessarily the right fit for them. They would need more of a skilled memory care.
And that's more 24 hours of
Yes.
someone being right there with you, or at least when you need that person.
It's more of a skilled staff, so there's going to be nurses and doctors on staff versus caregivers and CNAs. So that's where you see a big change in the cost as well as the licensure and the staff that are working.
Understandably, a big change in cost, yeah. We continue our conversation right after this, so please stay with us.